Hello, Assalamu alaikum. My name is Dr. Faisal Anwar. I'm an eye surgeon. Today we will discuss about retinal detachment and its causes and its treatment options that are available to us. Always remember the retina of the patient is a very important structure. It's a photosensitive structure. It creates electrical signals and that usually creates vision that is very important for the eye. Now, if your retina is affected due to some reasons, if you are myopic, having high numbers, if you are having any trauma to the eye, any injury to the eye, if you have eventful cataract surgery, and you have other eye disease like uveitis or any other disease that can create complication in the eye, you can get retinal detachment in your eye. Now, if once you have a retinal detachment in your eye, this is an ocular emergency and we have to operate this case as soon as possible. We operate these cases here, Lahore in Pakistan, as soon as possible, and we give these cases preference. Now, retinal detachment is of three types. Number one type is rheumatogenic retinal detachment, in which there is a break that is created in the retina. Now, if that break is addressed in time, we can create your total vision in the eye, and the patient can see like the patient doesn't have any disease or any injury in the retina. Second type comes that is called as exudative retinal detachment. In exudative retinal detachment, there is leakage in the retina. Now, when there is a leakage in the retina, there is a fluid that accumulates underneath the retina, and it can create a blind spot or a black spot in front of the eye. Now, in such cases, we also have operated as soon as possible. Even if we don't find a break, we have to treat such cases surgically if no medical treatment works. Third type is the diabetic retinal detachment, which is actually a tractional retinal detachment. In such cases, who are having diabetes, and diabetes is uncontrolled, and their diabetic retinopathy is at the last stage, they can get tractions on the retina, and they can develop a retinal detachment, which is called tractional retinal detachment. Now, in tractional retinal detachment cases, we prefer to use silicone oil with the laser application. Now, the laser we use is the organ laser photocoagulation, and we apply it to the whole of the retina. When we apply it to the whole of the retina and we put silicone oil, once it is added into the eye, the patient feels very good. The vision next day is almost 636, 624 partial, and the patient can see good when the whole of the blood is removed from the eye and the adequate laser is done in the eye. Always remember the laser is the crucial part of the retinal surgery. Now, if you don't get the laser on the retina, even if you are having a break or if you are having a diabetic retinopathy induced tractional retinal detachment, the vision cannot be recovered the next day. So always remember the role of the laser. Always discuss with your surgeon what type of laser you are getting, how much laser you will get, and how many breaks you are having in your retina, in your retinal tissue. Now, the surgery or the treatment options that we have are two types, or of two types. The one is external approach, and the other is the internal approach. Now, the external approach is actually scleral buckling approach. Now, if you are having small retinal detachment involving one quadrant and you are having your good vitreous, then we can go for scleral buckling technique. We can apply a sponge if it is in the one quadrant. We can cover that break with the sponge and we apply cryo. Cryo is sort of a freezing point technique or freezing point instrument that usually seal that breaks. Then we drain the fluid that is accumulated underneath that affected retina and we recover. We ask the patient to wait for a few weeks, then the patient recovers well. Now, if you are having a type of detachment that covers the one quadrant or more than one quadrant, we have to apply a tire. The tire is a bigger segment than the break, than the sponge, and it covers the break. If the breaks are more than one, or the detachment is a big, then we can apply even 180-degree tire in the eye, and we apply a band along with the tire. Now, when we tie the band and we apply the tire, we drain the fluid, and the patient recovers well, and the patient feels very good after the external approach. Next type of a treatment that usually comes is the vitrectomy. This is called pars plana vitrectomy. Now, in pars plana vitrectomy, we remove all the vitreous in the eye. We remove any damaged tissue that is whether in the vitreous, whether these are blood particles, these are pigments, any other material, and we remove it. Now, when we remove the whole of the vitreous from the eye, we usually locate that break that is present in the eye. When we locate that break, we remove the all the vitreous from the margin of that break, and we flatten the retina with fluid air oil exchange. Now, initially we perform fluid air exchange. When we perform fluid air exchange, we check the retina gets flat or attached. When the retina gets flat or attached, then we go further and apply the laser to the break. Now we actually apply 5 rows of laser to that break area, so break is sealed properly. Once the break is sealed properly, then no worries. Now you can recover well. Then we go to the next step, and that is silicone oil installation in the eye or gas installation in the eye that applies the tamponading effect to the break area and the detached area, and the patient starts recovering well. Now always remember, if your eye is not recovering well, always get checked in first 2 to 3 weeks. Sometimes the patient retina, even after the surgery, is not properly attached to its place, and we have to reattach or apply the reapply the laser to that area so we can get good vision follow post-operatively. The important point is the time of a surgery. If you get your surgery done in 7 to 10 days, then there are very good results. You can even recover your whole of the vision and you will feel very, very good. Now, if you delay it, your PVR, which is fibrosis in the eye, or which is, you can say, dead tissue in the eye, starts accumulating. And once the dead tissue in the eye starts accumulating, and then the recovery chances starts declining, and we cannot achieve our good results like 6.6, 6.9, or 6.12 vision. So always remember, once if you have oil, silicone oil in the eye and your retina gets attached, you have to get that oil removed. Always discuss with your surgeon. We will remove oil after 1 month, 2 month, 3 month, or even 4 months. So your vision gets better even after the removal of the silicone oil. The other type that usually comes is the gas surgery. Gas surgery is performed in selective cases in which retinal detachment is not that big and the PVR status is not that high. So gas can stay in the eye for at least 2 to 3 weeks or even 4 weeks and apply the tamponading effect to the eye so the eye can recover. So do remember, if you are having any issue related to retina or retinal tissue, we offer all the treatments here in Pakistan, in Lahore. You can contact us to get satisfactory results. And the time is important. Get it checked immediately. If you are having any issue relating to the eyes, feel free to contact us. Thank you very much.